When an elderly person enters the final stage of life, their body undergoes noticeable changes. Recognizing these 5 signs early can help families better prepare emotionally and provide appropriate care. Significant weight loss, a warning sign of elderly health decline. Unintentional weight loss in seniors is often overlooked, but it can be an early indicator of serious health deterioration. When the body no longer absorbs nutrients efficiently, it affects not only weight but also overall health. Causes of weight loss in the elderly. There are several reasons why seniors may experience sudden weight loss unrelated to diet or exercise. Poor nutrient absorption. As the digestive system weakens with age, it becomes less efficient at absorbing essential proteins, vitamins, and minerals. This leads to muscle loss, fatigue, and a weakened immune system. Muscle mass decline, sarcopenia. Losing muscle mass is a natural part of aging, but when it happens rapidly, it can cause severe weakness, increasing the risk of falls and injuries. Changes in taste and loss of appetite. As taste perception declines, food becomes less appealing, leading seniors to eat less. Additionally, the brain may send fewer hunger signals, reducing their desire to eat. Underlying medical conditions. Unintentional weight loss can signal serious illnesses like cancer, heart disease, kidney failure, or even depression. These conditions often progress silently, with weight loss being one of the first noticeable symptoms. Consequences of weight loss in seniors. A weakened immune system, increasing the risk of infections like pneumonia and urinary tract infections. Physical frailty, making them more prone to falls, fractures, and loss of independence. Higher risk of hospitalization, as the body struggles to fight off illness. What to do if a senior is losing weight suddenly? If you notice unexplained weight loss in an elderly loved one, schedule a medical checkup to rule out underlying health conditions. Provide nutrient-rich foods with protein, healthy fats, and vitamins. Offer smaller, easy-to-digest meals throughout the day. Encourage light exercise to maintain muscle mass and stimulate appetite. Weight loss in seniors is not just a sign of aging, it can be an early warning from the body. Observing, caring for, and intervening promptly can help ensure a healthier and more fulfilling life for your loved ones. Extreme fatigue and weakness in seniors, a sign you shouldn't ignore. Persistent fatigue is not just a normal part of aging, it can be a crucial warning about declining health. If exhaustion occurs even after adequate rest, it may indicate that the body is weakening and struggling to sustain normal functions. Causes of fatigue and weakness in seniors. Declining body function. As the body ages, it prioritizes energy for vital organs like the heart, lungs, and brain, reducing overall physical strength. Weakened circulatory and respiratory systems. Poor circulation and oxygen delivery to organs lead to low energy levels, resulting in sluggishness and tiredness. Poor sleep quality. Seniors may sleep more but often experience fragmented, shallow sleep, preventing proper energy restoration. Nutrient deficiencies. Inadequate protein, vitamins, and minerals, especially iron, vitamin B12, and hydration, can lead to persistent fatigue. Chronic health conditions. Conditions like heart failure, diabetes, depression, or thyroid disorders can drain energy and reduce enthusiasm for daily life. Consequences of persistent fatigue. Reduced physical activity, accelerating muscle loss. Declining memory and increased risk of cognitive impairment. Loss of interest in life, leading to depression and social withdrawal. Higher risk of falls due to lack of alertness and coordination. How to help a senior experiencing fatigue. If your loved one is constantly exhausted, take them for a health checkup to identify underlying issues. Ensure a balanced diet with sufficient nutrients. Encourage light movement to boost circulation and muscle strength. Create a comfortable environment that promotes restful sleep. Fatigue in seniors is not just a symptom of aging, it may indicate serious health deterioration. Timely intervention can improve their quality of life and longevity. Cognitive decline and social withdrawal in seniors, signs to watch for. As people age, changes in memory and behavior are expected. However, if an elderly person frequently forgets things, becomes disoriented even in familiar settings, or gradually withdraws from social interactions, it may signal severe cognitive decline. Causes of cognitive decline in the elderly. Reduced cerebral circulation. When blood flow to the brain becomes less efficient, the brain does not receive enough oxygen and nutrients, affecting memory, concentration, and cognitive abilities. Neurological disorders. Conditions such as Alzheimer's, dementia, or Parkinson's disease can gradually impair recognition, thinking, and responsiveness to the surrounding environment. Nutritional deficiencies. A diet lacking in vitamin B12, omega-3, and essential micronutrients can weaken brain function, leading to memory decline and confusion. Stress and depression. Many elderly individuals experience sadness, loneliness, and a lack of motivation, causing them to withdraw, avoid social interactions, and lose interest in their surroundings. Natural aging. As people age, brain cells gradually deteriorate, slowing information processing and affecting communication and memory. Warning signs to watch for. Frequent forgetfulness, even of familiar details like the names of loved ones or home addresses. Disorientation, even in familiar environments, with difficulty determining time and place. Reduced speech and reluctance to engage in conversations. Mood swings, frequent irritability, or becoming withdrawn and indifferent. Struggles with daily tasks, even simple ones like cooking or managing personal finances. Impact of cognitive decline and social withdrawal. Reduced quality of life, leading to feelings of isolation and disconnection from family and society. Increased risk of accidents due to lack of focus, getting lost, or forgetting to turn off appliances. Higher likelihood of developing depression due to feelings of helplessness and self-doubt. Increased risk of dementia if intervention is not provided in time. How to improve cognitive health in the elderly. Maintain a proper diet with brain-boosting foods like fatty fish, nuts, and leafy greens. Encourage participation in mental activities such as reading, playing chess, or learning new skills to stimulate brain function. Create a positive living environment, fostering communication and social engagement through clubs and gatherings. Schedule regular health checkups to detect early signs of memory and neurological issues. Cognitive decline and social withdrawal are not just signs of aging but may also indicate underlying neurological health issues. Timely attention and support can help seniors maintain mental sharpness, improve their quality of life, and extend their lifespan. Weakened immune system in the elderly, signs and solutions. The immune system plays a crucial role in protecting the body from bacteria, viruses, and other harmful agents. However, as people age, their immune system weakens, making them more susceptible to infections and slowing their recovery process. If an elderly person frequently suffers from infections or slow healing wounds, it may be an important health warning that requires attention. Causes of immune system weakening. Decline in immune cell function. With age, immune cells become less effective, making it harder for the body to detect and combat bacteria and viruses. Poor circulation. A weakened circulatory system reduces the transport of oxygen and nutrients to organs, affecting recovery and inflammation control. Nutritional deficiencies. A diet lacking vitamin C, vitamin D, zinc, and protein decreases antibody production, making the body more vulnerable to infections. Underlying health conditions. Chronic diseases such as diabetes, hypertension, and kidney failure can weaken the immune system and slow down wound healing. Natural aging. As the body ages, cell repair processes slow down, causing even minor wounds to take longer to heal. Warning signs of a weakened immune system. Frequent infections, such as pneumonia, urinary tract infections, and skin inflammation. Slow healing wounds, where even small cuts take weeks to recover. Absence of fever during infections. Elderly individuals may not develop a fever but instead feel fatigued or confused. Persistent fatigue, even without strenuous activity, or prolonged recovery after an illness. Increased risk of pressure ulcers, especially in individuals with limited mobility. Consequences of a weakened immune system. Higher risk of infectious diseases, particularly influenza, pneumonia, and tuberculosis. Poor recovery from illnesses, with a greater likelihood of complications. Prolonged skin damage, leading to severe infected ulcers. Reduced quality of life due to chronic fatigue and frequent illnesses. Ways to strengthen immunity in the elderly. Maintain a nutritious diet rich in vegetables, fruits, protein, and essential vitamins, D, C, zinc. Engage in light physical activities such as walking or yoga to improve circulation. Get sufficient sleep to allow the body to regenerate cells and recover. Stay up to date with vaccinations, particularly for influenza and pneumonia. Have regular health checkups to detect and manage immune-related issues early. Although immune decline is a natural part of aging, proper care can help seniors maintain good health and lower their risk of disease. Observing warning signs and applying timely preventive measures can significantly enhance their quality of life and longevity. Respiratory and circulatory changes in the elderly, health warning signs. The respiratory and circulatory systems are essential for sustaining life. However, as people age, physiological changes can impair their function. Unusual breathing and circulation patterns may be early warnings of serious health conditions that should not be overlooked. Causes of respiratory and circulatory changes in the elderly. Decline in heart and lung function. As the heart weakens, its ability to pump blood throughout the body decreases. The lungs also lose elasticity, making gas exchange less efficient. Oxygen deficiency due to poor circulation. Reduced blood flow prevents tissues and organs from receiving sufficient oxygen, leading to symptoms like pale or bluish skin and cold extremities. Fluid accumulation in the lungs. With age, the body's ability to clear excess fluid diminishes, leading to fluid buildup in the lungs, causing shortness of breath or persistent coughing. Irregular breathing patterns. Breathing may become erratic, alternating between rapid breathing and short pauses, Cheyne-Stokes respiration. Underlying health conditions. Diseases such as heart failure, hypertension, and chronic obstructive pulmonary disease, COPD, can further exacerbate respiratory and circulatory decline. Warning signs to watch for. Irregular breathing, alternating between rapid breathing and brief pauses. Pale or bluish skin, often noticeable on fingertips, toes, and lips due to poor circulation. Cold hands and feet, reduced blood flow, especially in bedridden individuals. Persistent shortness of breath, the individual may feel breathless and need to sleep with their head elevated. Chronic coughing, particularly dry cough or phlegm-filled cough due to fluid accumulation in the lungs. Effects of respiratory and circulatory decline. Reduced oxygen supply to the brain and organs, leading to cognitive decline, dizziness, and fatigue. Increased risk of heart failure and stroke as the heart works harder to compensate for poor circulation. Higher susceptibility to lung infections, particularly pneumonia. Difficulty with daily activities due to fatigue and shortness of breath. Ways to improve respiratory and circulatory health. Engage in gentle physical activities such as walking or deep breathing exercises to enhance lung function. Sleep in a proper position, keeping the head elevated to ease breathing. Keep the body warm to promote better blood circulation. Ensure adequate nutrition, including iron-rich and omega-3 foods to support circulation. Avoid polluted environments and exposure to smoke or dust, which can worsen respiratory issues. Regular health checkups to monitor heart and lung function and detect potential risks early. Respiratory and circulatory changes are not just part of aging but can also signal serious health conditions. Recognizing symptoms early and taking preventive measures can help improve the elderly's quality of life and reduce the risk of complications. Preparing for end-of-life care, a journey of love and compassion. Life is a journey, and the final stage for an elderly person is a natural part of that path. Signs of declining health may appear months or even years before someone reaches the final phase. Instead of trying to reverse this process, what matters most is creating a loving and peaceful environment, helping them feel as comfortable and at ease as possible. Recognizing end-of-life signs. Physical and mental changes during this stage may occur gradually, including cognitive decline, forgetfulness and disorientation, even in familiar settings. Loss of interest in life, withdrawal from conversations, reduced communication, and loss of enthusiasm for past interests. Changes in eating habits, decreased appetite, altered taste, or difficulty swallowing. Sleep disturbances, sleeping more during the day while experiencing difficulty sleeping at night. Physical weakness, increasing fatigue, difficulty moving, and higher risk of falls. Respiratory and circulatory decline, irregular breathing, pale skin, and cold extremities due to poor circulation. These signs do not indicate an immediate end, but serve as reminders for families to prepare emotionally and physically. Providing care in the final stage. Care at this stage goes beyond medical attention. It's about ensuring that the elderly feel loved and at peace. Here's how to support them. Ensure physical comfort, assist with eating, hygiene, and creating a calm sleeping environment. Keep them warm and help manage pain. Offer emotional support, listen to their thoughts, share stories, read to them, or simply hold their hand to provide reassurance. Respect their wishes. Some may prefer staying at home rather than in a hospital. Fulfilling their final wishes within reason can bring them comfort. Prepare emotionally as a family. Witnessing a loved one's decline is challenging. Understanding the natural course of life can help ease emotional distress and allow families to focus on love and connection. Seek professional support. Hospice care professionals, palliative care specialists, and psychologists can help both patients and families navigate this stage with greater ease. Making the final days meaningful. Instead of focusing solely on loss, see this stage as an opportunity to connect and cherish time together. Words of love, warm embraces, and reminiscing on shared memories can bring deep comfort. Ultimately, the most important thing is not prolonging life at all costs, but ensuring that loved ones pass peacefully, gently, and surrounded by love. Cherish every moment with them, because love is the most meaningful gift we can offer in their final days. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe to the channel for more valuable health tips.